After 60, your body and brain change, but nobody hands you a guide. I'm a urologist with over 20 years of experience, and I've seen how certain habits around masturbation, even ones that seem harmless, can affect older men's health in ways they never expected. Let's talk about 3 common mistakes older men make, and what to do instead. Mistake number 1, overuse of digital stimulation. First, relying too much on screen-based stimulation. High-speed visual content triggers massive dopamine spikes. Over time, this can reduce your brain's sensitivity, leading to reduced interest in real-life intimacy, delayed arousal, or even performance issues. One of my patients, Tom, 66, was healthy but had lost all desire for physical closeness. We traced it back to years of daily screen use. With guidance, he reduced his digital dependency. In 3 months, his interest and performance began to return. Dopamine needs recovery time, and your brain is still plastic, even at 60 plus. Mistake number 2, ignoring prostate signals. After 60, the prostate often enlarges. That's called BPH. Frequent or intense masturbation, especially without full arousal, can irritate the gland, leading to discomfort, pelvic pain, or urinary changes. Harold, a 71-year-old patient of mine, came in with burning and pressure. He thought it was just aging. Turns out, he had low-grade prostatitis from overstimulation. With a few lifestyle changes, hydration, pelvic relaxation, reduced frequency, his symptoms eased up. Always listen to what your body is trying to say. Mistake number 3, using it to avoid emotions. Samuel, 68, lost his wife and used late-night stimulation as a way to avoid the silence. He told me, "It's the only thing that helps me sleep." But he wasn't sleeping well. He was drained, unmotivated, and sad. We talked, connected him with grief support, adjusted his lifestyle. Slowly he began to heal, emotionally and physically. If this is your only coping method, it's not pleasure, it's a mask. In conclusion, what can you do? Number 1, limit screen-based stimulation. Number 2, notice pain, pressure, or changes, and talk to your doctor. Number 3, address loneliness or grief. It's not weakness to ask for help. Number 4, get hormone panels checked, especially testosterone and cortisol. Your sexuality doesn't end with age, it evolves. And when you treat your body with care, it'll return the favor. Remember, it's never too late to feel better, stronger, and more connected. If you found this helpful, please subscribe and consider sharing it with a friend.